Can I please introduce Kimi Henare? You know him well from previous talks. As you know, he's a biomedical scientist, and like George, he's a member of the Māori Cancer Leadership Group, Hei Ahuru Mōwai. Kimi.
Tēnā nō koutou katoa. Thank you very much for the opportunity to speak again. I'm going to reflect on the Treaty of Waitangi as an instrument to help us shape the way forward. And I guess I'm trying to make a rights-based argument, really, around the way forward, and I'm reflecting on things in Aotearoa. So for Māori, I think it's pretty well clear how we do it. But I think maybe there's principles or values in there that you could extrapolate. Not to say that necessarily the Māori way is the right way for all Indigenous. I'm not in that position to say that, but just to highlight some examples. And just a quick reminder, for those of you who don't know much about Te Tiriti, obviously Associate Professor Karen Paringātai did a great job the other day explaining Te Tiriti for us. And you might come across the treaty principles in a lot of health documents, public health documents. I'm a big fan of Te Tiriti o Waitangi for the simple fact that pretty much all the Māori chiefs who signed it back in the day signed the Māori version. And there were language differences, there were translation differences, and it usually spoke to different levels of power. So I think if you're going to do things for Māori, you should go by the one that the Māori chiefs signed and agreed to. And simply speaking, at risk of oversimplifying, Article 1 talks about how Māori gave the Queen te Kāwanatanga katoa, which is complete government over their land. How does that translate to research? To me, it's researchers making good, informed decision, discussing, consulting with Māori, consulting with Indigenous people, and making decisions based on what Indigenous people are asking for. That's good decision making. Article 2 is where Māori were guaranteed te Tino Rangatiratanga over their taonga katoa. Essentially, that means self-determination of Māori over Māori, all things that are precious to Māori. Data, tissues, DNA, health are all considered taonga, as well as lands and all the other things. So making sure, prioritising that Māori or Indigenous people have the right and opportunity to exercise self-determination over things that are precious to them. Article 3, equity. We've been talking about equity all week, so it should be pretty clear to you. It actually means, technically speaking, it actually means equality, but we can't have equality. We're a long way away from that. So we have to achieve equity to get into a position to really honour what Article 3 says. That's what I think. Moving on, how do we do this in research? I want to hopefully give you some examples. Kāwanatanga in research, researchers making good decisions. Number one is making sure that Indigenous voices can shape your research, taking rights-based approaches as asserted by UNDRIP, United Nations Declaration of Rights of Independence, which of course is an international instrument to assert those rights. They're not new rights, they're the same rights Indigenous people have always had. It's just that for whatever reason, we're not seeing them being asserted. They're not completely new made-up rights. They're just an assertion of existing rights for Indigenous people. Te Tiriti o Waitangi and Aotearoa, very similar. Making sure that the research we do addresses priorities and interests, and how do you know? You ask community and you ask Indigenous scholars who have a responsibility of being engaged, but providing that subject matter expertise as well. Both together, not one or the other. Protecting Indigenous FTE and workforce, ideally multiple, not just putting all of the work on one. Actually securing jobs and giving them leadership roles and protecting them and supporting their work and doing things like that. Number two, as researchers, all of us, it's reflecting on existing literature, even if, one, it's uncomfortable. Colonisation, marginalisation, racism, understanding the impact of these things on our healthcare. Number two, reflect on also if it might take time, but also understanding a shift towards cultural safety. So not just cultural competency, understanding power dynamics and the impact there. And relating that to the Meihana model, by doing those things, I think that when you think about applying things like the Meihana model with how you engage with the Māori or an Indigenous participant, it will put you in a better stead to do that. Number two, asserting, basically it's Indigenous data sovereignty is a clear example. being able to apply Article 2 of the Treaty of Waitangi or UNDRIP Article number 31, which explicitly says that Indigenous people have the right to make decisions over their cultural knowledge, intellectual property, genetic material, it literally says genetic material and resources, and that nation states support them to be able to do that. Tissue, DNA, data. How can we as institutions ask them to trust us? We're asking them to trust us with their tissue and data, yet institutions, we struggle to trust them with governance over those sorts of things for whatever reason. So recognising that power imbalance and perhaps reciprocating the trust model, if that makes sense. Finally, Ōritetanga, which is around equity. I'm just going to point to this example, which is about study design, trying to achieve equal explanatory power. And it's been done before. In a primary setting, yes, but there's a nice clear table of how they did it, and they were really careful about their design, but essentially it was trying to design studies so that actually you could answer the research question, not just try to recruit participants sort of as they come in the door. It's deliberately making choices around your design to maximise participation of Indigenous people so that Indigenous people can be seen in the data sets that we are using to bring drugs to the market or implement it into our health system. That's enough. Last of all, it's already been said a couple of times before this week, nothing about us without us. Tēnā koutou katoa.